Assalamu alaikum. I am Dr. Khadiza from Bashundhara Ad-din Medical College. Student, today we are going to discuss about respiratory system. Item number 2. This item includes composition of atmospheric air, or inspired air, alveolar air, and expired air. And also discuss about the respiratory unit, respiratory membrane, and the diffusion of gases through the respiratory membrane. Now, composition of air. Alveolar air does not have the same concentration of gases as atmospheric air because the alveolar air is only partially replaced by the atmospheric air with each breath. Oxygen is constantly being absorbed into the pulmonary blood from alveolar air. Carbon dioxide is constantly diffusing from the pulmonary blood into the alveoli. Dry atmospheric air that enters in the respiratory passage is humidified even before it reaches the alveoli. Inspired air mixes with the alveolar gases and replacing the oxygen that has been entered the blood and dilute the carbon dioxide that has entered the alveoli. The volume of gas in the alveoli is about 2 liters at the end of expiration. That is the functional residual capacity. In healthy 150 pound or 68 kg person, only the first 350 ml of 500 ml inspired air with each breath mixes with the air in the alveoli. Conversely, with each expiration, the first 150 ml expired air is that occupied the dead space, and the last 350 ml is gases from the alveoli. This is the table. It shows the partial pressure of respiratory gases in atmosphere, in alveoli, and expired air. It shows that the composition of air, that is nitrogen, carbon dioxide, oxygen, and water. In atmosphere, you can see the partial pressure of nitrogen is more. It is 597 millimeter mercury, and then partial pressure of oxygen is 159 millimeter mercury, and carbon dioxide 0.3 millimeter mercury, and water 3.7 millimeter mercury, and total is 360 millimeter mercury. If you can see this partial pressure of is changes in alveoli, but nitrogen, in case of nitrogen, it is almost same in alveoli and expired air, but oxygen, you can see that partial pressure reduces in alveoli, and but in expired air it is and again increases because of mixture of the dead space air. On the other hand, carbon dioxide, partial pressure of carbon dioxide increases in alveoli, and in expired air, this composition, this partial pressure of oxygen in expired air is reduces because of mixture of the dead space air. And water, partial pressure of water, you can see it increases in alveolar air and it remains same in expired air because of humidification. So next you can see this figure shows partial pressure from different gases in different areas. Now, humidification of air in the respiratory passages. As soon as atmospheric air enters the respiratory passage, it is exposed to the fluid that cover the respiratory surface. Even before the air enters the alveoli, it becomes totally humidified. The average male functional residual capacity of the lung measures about 2300 milliliters. Yet only 350 ml of new air is brought into the alveoli with each normal inspiration, and this same amount of old alveolar air is expired. Therefore, the volume of alveolar air replaced by new atmospheric air with each breath is only 1/7 of the total. So, multiple breaths are required to exchange most of the alveolar air. The figure shows the rate at which of renewal of alveolar air. In the first alveolus of the figure, excess gas is present in the alveoli, but note that at the end of the 16th breath, the excess gas still has not been completely removed from the alveoli. So, what is the importance of this slow replacement of the alveolar air? that it prevents sudden change of gases concentration in the blood. It prevents excess increase and decrease of tissue gas oxygenation, tissue carbon dioxide concentration and tissue pH when respiration is temporarily interrupted. Now we will discuss the respiratory unit and respiratory lobule. It is the unit structure of lung where the gases exchange take place. Each respiratory unit is composed of respiratory bronchiole, alveolar duct, atria and alveolus. All membranes of all these structures are collectively known as respiratory membrane. There are about 300 million alveoli in 2 lungs. This figure shows the zone of respiratory tract. It is composed of conducting zone and respiratory zone. Conducting zone extends from the bronchi to the terminal bronchiole. On the other hand, respiratory zone extends from the respiratory bronchiole to the alveolar sac. Now students, you can see this figure, it shows the alveoli how respiratory zone. In the respiratory zone and the alveoli, and each alveoli are highly vascular. It is surrounded by the network of capillaries so that gases exchange easily take place. This is another cross-sectional of respiratory zone. This is a figure of respiratory unit. Now, we will discuss the respiratory membrane. The membrane structure through which the exchange of respiratory gases take place. It is formed by the structures belonging to alveoli and capillaries. Thickness is about 0.2 to 1 micrometer. It is about 0.6 micrometer. Total surface area is about 70 square meters. And this is the figure. It shows the respiratory membrane. The blue area indicates the alveolar zone, and the interstitial space, and the red area shows the indicate the capillary. So and the arrow shows the diffusion of gases diffusion of gases. It shows that oxygen diffuses from the capillary from the alveoli to the capillary, and carbon dioxide diffuses from the capillary to the alveoli. So what are the layers? First layer is a layer of surfactant with fluid inner lining the alveoli, then the alveolar epithelium, then epithelial basement membrane, then interstitial space, capillary basement membrane, then capillary endothelial membrane. This figure showing immediate relationship between the capillaries, interstitium and alveolar epithelium. Now the factors that affect the rate of gas diffusion through the respiratory membrane. First is thickness of the respiratory membrane, then surface area of the membrane, partial pressure difference of gases between the two sides of the membrane, and then diffusion coefficient. Now we will discuss the thickness of the respiratory membrane. The rate of diffusion through the respiratory membrane is inversely proportionate to the thickness of the respiratory membrane. Any condition that increase the thickness of the respiratory membrane can interfere in the gas diffusion. That means example, pulmonary edema, fibrosis of lung. Now the second point, the surface area of the membrane. The rate of gas diffusion is directly proportional to the surface area of the respiratory membrane. When the total surface area is decreased to about 1/3 to 1/4 normal, exchange of gases through the membrane is impeded to a significant degree. The example, emphysema, cancer, tubercular destruction. Now the partial pressure difference of gases between the two sides of the membrane. Rate of gas diffusion is directly proportional to the pressure difference across the respiratory membrane. When the partial pressure of alveolar gas is greater than the pressure of gases in the blood, net diffusion occurs from the alveolar to the blood. Now we will discuss the diffusion coefficient of gas in the substance of the membrane. Diffusion coefficient depends on the gas solubility of the membrane, molecular weight of the gas. Carbon dioxide diffuses about 20 times more than oxygen. Now what is a diffusion coefficient? It is equal to the gas's solubility in the membrane divided by the square root of the gas's molecular weight. So, diffusion coefficient is equal to S by root over mW, that is S means solubility of the gas and mW means molecular weight of the gas. Diffusion coefficient of oxygen is 1 whereas carbon dioxide 20.3. It is obvious from the formula that the characteristics of the gas itself determine two factors of the formula, that is solubility and molecular weight. Together these two factors determine the diffusion coefficient of the gas. Now we discuss the diffusing capacity of respiratory membrane. The volume of gas that will diffuse through the membrane in each minute for a partial pressure difference of 1 mm of mercury. Diffusion capacity under normal resting condition for oxygen is about 21 milliliter per minute per milliliter of mercury, and for carbon dioxide 400 to 450 ml per minute per milliliter of mercury, as carbon dioxide is 20 times more soluble than oxygen. But in diffusing capacity may increase in exercise. For oxygen, it may increases to 65 ml per minute per millimeter of mercury, and for carbon dioxide, it may increases to 1200 to 1300 millimeter per minute per millimeter of mercury. You can see this figure, diffusing capacity of different respiratory gases, and you can see that during exercise, diffusing capacity of respiratory gases, that is oxygen and carbon dioxide, increases during exercise. You can see that in alveoli, partial pressure of oxygen is more, that is 104, and it reduces at the cell, it is about 23, and partial pressure of carbon dioxide is about 40 millimeter mercury in alveoli, and it in the cell it is 46 millimeter mercury. We will discuss later when we will discuss transport of oxygen and carbon dioxide, then we will discuss in detail the partial pressure changes in different areas. Now we will discuss the physics of gas diffusion, gas partial pressures. Molecular basis of gas diffusion is all the gases of concern in respiratory physics are simple molecules that are free to move among one another, a process called diffusion. It is also true of gases dissolved in the fluid and tissue of the body. So, diffusion is directly proportional to the pressure delta P, that is pressure difference between the areas, and A, that is cross sectional area, and S, that is solubility of the gas, and diffusion is inversely proportional to the D, that is distance of the diffusion, and square root of the mW, that is molecular weight. Now, what is partial pressure? The partial pressure is the pressure of each gas in a gas mixture. So, partial pressure is equal to concentration of dissolved gas by solubility coefficient. Factors that determine the partial pressures of gas dissolved in a fluid. The partial pressure of gas in a solution is determined not only by its concentration but also by the solubility coefficient of the gas. When the partial pressure of a gas is greater in one area than another area, there will be net diffusion from high pressure area towards the low pressure area. So, student, you can see in this figure that the red molecules indicate the gas molecules, and the molecular movement occurs from the higher area towards the lower area, and this is called diffusion. So, student, that's all from of today's class, and thanks for watching. Allah Hafiz.